you're watching BloombergQuint. Now, at the start of India's nationwide lockdown in March, Dr. Jayaprakash Muliyil, a leading epidemiologist, told me that the 21-day lockdown was the minimum that this country needed. Since then, India has, of course, extended its lockdown by another fortnight. It now comes to end on May 3rd. But it's not clear if we have succeeded in flattening the curve or, in simple layman language, reducing the momentum of the spread of the virus. Dr. Muliyil joins us again to take stock of the situation as some economic activity restarts in many states across India today, that is April 20th. Dr. Muliyil, thank you very much for speaking to us yet again. Appreciate your time, and I'm glad to see you're well. Let me start by asking you a very simple question, which I hope you will explain to us in very simple layman terms. Have we succeeded in flattening the curve?
Well, that question is very easy to answer. We have, and we have data to show that the curve indeed has been flattened. But the word success, you have to be interpreted cautiously because it will depend on our goal is. So to answer your question, yes, it has made a difference in slowing down the transmission of the disease.
Okay, but so what data are you looking at, or what data convinces you that we have flattened the curve without using the word successfully? The reason I ask is because all of this is very new for us. So many people are reading many different cuts of the data to arrive at different conclusions. You're the expert.
There is a particular parameter we measure in studying these epidemics, and that comes from this basic reproduction number. We started with something, but it seems to have come down, indicating that there is a reduction in the disease transmission. You can make out the same thing by looking at the doubling time, and there appears to be a slowing down at the rate at which the epidemic is spreading.
Dr. Muliyil, if I remember correctly, the last interview that we did, the reproduction number, or R0 as it's known as, you told me for India, you assessed to be at somewhere around 2. Have you, has that now reduced to give you comfort that we've flattened the curve? And as far as the other data point that you speak of, which is the, the momentum rate or the doubling rate, the Health Ministry just a few minutes ago seems to claim that from 3.4 days before the lockdown, we're now taking in India 7.5 days to double the number of patients. Is that satisfactory? Do you believe that amounts to some degree of success?
No, that is not the way to interpret it. We wanted to slow it down, to buy time. Why did you want to buy time? To prepare ourselves to face the epidemic. Because if you believe that you can actually get rid of the problems due to virus by locking down and reducing doubling time, that is not true. It will inevitably spread everywhere. So we have slowed down the rate at which spreading, but that is not a solution at all. The solution is completely different, and if I recall, during the last interview, I did mention it to you.
Yes, if I remember correctly, the solution that you're referring to is herd immunity. But before I get to that, sir, the reproduction rate that you were referring to in your previous response, the last you told me you were expecting R0 at 2. Has that reduced? Is that what's giving you comfort?
No, it doesn't. It's a description of an epidemic. And okay. I think I used a number 2.4, I can't recall, because these are calculated numbers, estimates you make. It is the average of several data points that you get. So it's ranging around that. So it has come down, which means the rate at which the epidemic spreading has gone down. But that doesn't eradicate the virus. That is the problem.
How much has it come down by, sir, according to your calculations?
Quoting other people, people are saying it will come down to 1.8, probably 1.7. And that is the kind of rate people are talking about. They differ according to the methodology and according to the way they calculate it. But again, it's a fairly good estimate to indicate there has been a slowing down at the rate at which the epidemic is spreading in the country.
Fair enough. So a couple of more questions. Now, these numbers that you speak of, they're all based on a very limited number of tests that we've done in this country for a variety of reasons, and I won't get into the reasons right now. But when you look at the latest ICMR data, they've said they've tested just over 4 lakh samples and just over 3.8 lakh individuals. Now, in that, we've arrived at about 17,615 confirmed COVID-19 cases of patients. What do these testing numbers tell you? Are we still testing very poorly or very slow, very little? Have you seen any improvement? Do we have a long way to go yet?
The number just tells you how prevalent the virus is. And a number like that is like a snapshot. You test some people, and in that proportion, how many have the illness or the infection. Now remember, majority of the people who get the COVID-19 virus will be asymptomatic, absolutely no symptoms. Now, we started off by testing only the patients coming with sickness. That gives us an indicator, A, is there a disease existing here? And we establish that. Now the question is, how prevalent it is. Now to realize what it is, it's a little difficult just by using the test you described. This is the RT-PCR. What we need to do is to get the rapid test going. That tells you what proportion of our people have been already been infected by the virus. That is the line. Because we are fighting an enemy whom we cannot see, and the enemy moves surreptitiously without hurting anybody. So you don't know where all it has spread. The one way to get it done is the IgG, which is part of the rapid test. And that will give us a clear indication how big the spread has been.
I'll come to the rapid test in one bit, because there seem to be some concerns, not just raised in India, but across the world, about the quality and efficacy of these rapid tests or rapid antibody tests and the number of false positives, false negatives, etc. But I'll come back to the data of the testing. Are we testing enough yet? Have we started testing asymptomatic people in your assessment? What more do we need to do to be able to actually capture the reality of this virus and its spread in India?
In my opinion, testing and isolation is okay in the early phase, at least during the containment phase. Once the disease has become established all over, and we see evidence of that it has taken a firm foothold on the country. Now, I'm from the purely management point of view. These procedures or maneuvers hardly ever create an impact on the spread of the virus. Testing informs you, but testing really doesn't have an impact at the rate which the disease can spread. That is a difficult notion to imbibe. It is technically impossible to test and isolate every single infected person. And the number of them seems to be large. Every time you see a case who's come to the hospital, there are 75 others outside who don't have clinical disease or they have very mild symptoms. We can never know them. So the problem with this disease is that it spreads so fast.
That 75 number that you just pointed out, sir, is that just a number you picked at random to represent the widespreadness of this disease, or is that a calculated number of some sorts?
Recently, there was a study from California. What they did was they measured the IgG, or how many have been infected in the community, and then compared with the number of cases that knew that had approached the hospital. And that number told us there are quite a few others who are not had any clinical illness, but they are IgG positive, indicating they had been infected. Now the 75 is the middle point of the range they suggested, something like, they said something like 50 to 80. I said 65, I think. 65 is a better number.
Okay. So those who make the argument that, the economic costs that we're paying on account of the first lockdown and then the extended lockdown, and of course these are very severe costs, and I'm not trying to undermine them at all. But when you look at those costs and the way they read some of the data, for instance, the number of confirmed cases per 100 tests is only 4.4, which is a much lower ratio than anywhere else in the world. These are not accurate ways to understand the spread of the disease, according to you.
Well, in fact, you don't need to test a large number. You have to test sensibly in each state or each district, just to get to feel of how much they're spending. There's a systematic way you can study that. The overall number is, when it's low, it's uncomfortable. I think we are testing enough. And the problem with the testing is, the RT-PCR remains positive transiently. It is positive, and within a week or 10 days, it becomes negative. And I don't know which test they are actually using now, because it has a sensitivity problem too. So I'm saying, I know you are using a general term in terms of test. And I also agree we should test enough. But it doesn't give you, if it gives you a comfort that, we are testing enough large number, 1 million, that doesn't stop the epidemic in any way. We just know it is spreading, that we already do. We know there is enough to be anxious about. We know the disease is spread all over. And we have to now look at the way we mitigate the whole situation. And by that I mean prevent deaths. Testing doesn't prevent deaths.
So what numbers, you told me that the reproduction rate is one number that you were using to get a better sense of whether India has managed reasonably to deal with the spread of this disease, and that the fact that the reproduction rate has reduced gives you some degree of confidence. What are the other data points and the variety of data points that you see that you're using to understand fully the spread of this disease, the ability to deal with this disease, whether India is better off or worse off than most other countries, because people are, like we last discussed, attributing lower number of cases in India to hot weather, the BCG vaccine, all kinds of theories. What is the data points that you find, confidence in?
Now, the R naught that we discussed last time, and I don't recall exactly what all we discussed, but that is a point I use to estimate the expected herd immunity. For example, influenza had an R naught of 1.7, but it spread much faster because it had a regeneration time which is very measured in hours. So there are different characteristics which describe the rate of spread. But R naught gives you a kind of estimate at what proportion of the community has to become infected before the epidemic stops on its own.
And the last time you told me that you estimated the herd immunity required in India would be 55%. You might recall I had then said that's half, and you said no, that's more than half. So half the number of people in this country, of course. Is that still the herd immunity number that you're working with?
No, the herd immunity number has gone up to 60 or 65, and there are more studies coming up. Now remember, this herd immunity is function of the density of the population. In rural area, it is less dense, and the herd immunity are not maybe lower, and consequently the density that you require or the proportion to be infected may be less. In the other hand, an area like Dharavi in Mumbai, the density of the population is high, and so it is difficult to understand this as an average value. You have to remember that it's it shifts in terms of magnitude from area to area. The calculated R naught in the ship, what is Diamond Princess, was 14.8. That's a huge number because they were all locked into one ship. And some of the slum areas have a very high density. On the other hand, the rural area, it will be much less. So, your question cannot be answered in simple terms for a whole India. We work on averages, and the actual situation may vary from place to place.
Okay, one of the other points or numbers or data sets that people are looking at, again, to be able to make the argument that maybe the lockdowns need to lift faster because of the economic consequences, is the death rate per million, which again in India is much lower than in many other countries. How do you read the number? I think the last John Hopkins data seem to suggest 0.41 per million in India versus 3.34 in China, 124 in the US, and then much, much higher rates in other European countries like Spain and Italy.
Did you say 0.3 per million?
Yeah, this is per million, 0.41 per million.
I'm not familiar with the number you're quoting, but let me ask you a question. Now, did you hear about the Japanese government saying that they expect 4 lakh deaths? There is an announcement from the government, 4 lakh deaths that they are expecting during the epidemic. Now, India's population is 10 times that of Japan. So how many would you expect if the same rate were to happen?
We're also a younger demographic, sir.
So the estimates, we are to go by the younger population, and actually we should be estimating our death rate, the number of deaths would be 4 million approximately. But the only bright side is that we have a solution to the problem, and the solution to the problem, I might have mentioned earlier, is that 80% of those will belong to above 60 years of age. So if you devise a method of isolating them somehow, then the whole mortality will fall. I cannot see any other way reducing the burden of mortality due to this virus in India.
Dr. Muliyil, we've had an extensive conversation so far on many of these data points. I'm going to ask you one question again, because you're the expert, but nowadays there are many other experts out there on social media and otherwise trying to determine all these numbers and their impact on the economy, etc. Lots of people argue that we aren't seeing a flood of cases in hospitals. There is no anecdotal evidence that suggests that city hospitals, urban centers, health centers are being flooded with cases. So these are believable data points that India is putting out. The spread, even though we're testing less, the spread may not necessarily be much more, because if it was much more, we would hear of dozens of cases in dozens of hospitals across India, to indicate that these numbers that are officially being put out may not represent the true picture. How do you respond to that argument?
My heart wants to believe it, but I'm scared. Okay, so I want to believe that. But my brain doesn't permit me to go along with that argument at all.
Why is that?
Thing is, I know what the arguments are, and I have kind of taken a lot of time of yours. The point is that every age is a strong factor in our favor. All others are hypotheses, and I hope they are true, but I have no evidence to support in my mind. So I'll be cautious. I will still prepare for a large number of cases, because when they land up at the doorstep of the hospital, we should not be found wanting.
Do you believe that the additional measures of preparedness that states and the central government have attempted to put in place in this more than 25-day lockdown so far are sufficient to deal with even this projected caseload?
Well, not the total projected caseload, because the problem is they will all happen very rapidly. So we may be overwhelmed. Other countries have also been overwhelmed. But if you are able to keep the elderly out for some way, not all of them won't be possible, but at least 75% of them, then you will have a 75% reduction in the number of people seeking hospital care. So that is what I am kind of hoping will happen, because you've seen elsewhere in another part of the world how frightening this epidemic can be.
So are you in agreement of lifting a lockdown on May 3rd? I know this is a really tricky question because of the economic consequences of an ongoing lockdown, but nonetheless, from a health point of view?
From a lockdown is only going to prolong the whole situation, and there is no end to it. We may go on for 3 months, 6 months. Do you think we can live on a lockdown for that long? Remember, children get pneumonia, meningitis, and their access to healthcare is now limited. And immunization schedules have been stopped. We may have other outbreaks coming on. This is apart from the economic and agricultural trauma we'll have to face. So I'm confident the experts helping the government will see through this, and they will make sure that these activities are sustained in future, and probably social get-together and such things should probably be curtailed for some more time to come.
All right, so Dr. Muliyil, one last.
Go ahead.
Please go ahead. Please go ahead, sir.
No, I'm not in favor of a completely opening up. Certain restrictions have to be there in large crowds gathering and so on and so forth.
Yes, I do recall in our first interview, you had mentioned that social distancing or physical distancing should now become a way of life for many of us, at least for the next year or so, till a cure or a medical solution is found to this. And that is really my last question. There are a ton of efforts going on across the world to find both a treatment for this virus that is effective as well as a vaccine. Are any of these looking very encouraging to you?
Medicine is very iffy. On the other hand, whatever I have read about vaccine looks very, very plausible. That remember, this vaccine's issue of whether it will protect is not the main question. I think it will, but it will do harm to some people is what we have to clarify. And for that, it takes a little while before we subject population to mass vaccination program. The delay is mainly because of the safety issues. And I am more confident and hopeful that there will be a vaccine available at least within 2 years.
Within 2 years, is there a particular vaccine effort that looks best to you?
No, I am not an expert on that. There are several, about 40 odd vaccines. I cannot comment.
All right, fair enough. Dr. Muliyil, as always, appreciate you having found the time and clarified so many of these things for us. Thank you very much for speaking to BloombergQuint.
You're welcome.